Okay, so now I was supposed to have my colleague and fellow board member join the stage with me, Santo, but unfortunately he had a family emergency. So I'm going to take over his part. So you get a little bit more of me, Susan Ruediger, here at the stage. And you've heard about the significant investment and the significant increase in investment that we've had in CMT drug development. Going back to my notes here. Um, the momentum really feels real, and I don't want to underestimate or understate that enough. But most of this momentum has been fueled by you all. You may recall in 2021, here at this meeting, we launched the CMT1A Endgame campaign. And that was a campaign that was really focused on raising money and spending it for CMT1A drug development. And a lot of you want to know, why did we pick 1A for this $10 million campaign? And the reason why we picked it was because we're a scientifically based organization. We had to lead with the science. So what we learned is that there's a good basic understanding in CMT1A. We've heard this a couple times today in the room. If we reduce the levels of PMP22, that protein that those of us with 1A have too much of, we can see the disease get ameliorated in the mice. We can see their symptoms reversed. It's pretty powerful. So we know this, and we know that when we do this, we see this reversal. So then we have these robust pathways to our treatments. And what that means is we have the drugs that can silence that extra copy of that PMP22. We just have to figure out ways to get them into the nerves. And also, the interesting thing about CMT1A, and I don't want to be a little cynical about this, we've heard this a little bit today. When you're talking about the ultra rare diseases, it's like that interest in industry. Can the pharmaceutical companies get enough patients to make this investment worth it? And with CMT1A, because it was the most common type, we knew that there was interest in industry. And we thought, if we take this basic knowledge, we invest heavily into it, then maybe we can get some interest from industry and start building some momentum. So we did that. We raised $10 million. Actually, we raised $10 million. Where's my actual number? 157,000, something like that. So we reached our $10 million goal in 3 years, and we funded these 9 programs. Two of them aren't showing up here on this slide. I don't know why. But we fund those 2 yellow circles are supposed to have icons in them as well. So we funded these 9 programs, and not all the 9 programs are going to succeed. Okay, let's be honest. We heard that from Janine. But what we have to do is we have to increase the number of shots on goal, as we like to say. We have to increase the number of drugs that have the opportunity to. So with the $10 million raised by Endgame, we invested in these 9 programs. By the way, we still have some money to spend. We didn't spend all 10 million of it. And we're continuing to invest in the 1A projects for sure. But half of you in this room know, well, everyone in the room knows that CMT1A only affects about half of us. And it's not the only disease that we at the Research Foundation set out to find treatments and cures for. Let me just go back to this slide for a second and tell you, when we invest a little bit at the CMT Research Foundation, we hope to blow that up into a huge investment. And we've got 2 short examples for you here. Number one, we invested in 2020 in a company called DTX Pharma. They had a delivery vehicle that they thought they could they could apply to CMT1A, put this little PMP22 silencer in it, and try it out in the mice. We gave them $127,000 to try a CMT program. When we met them for the first time, I said, do you have any data on the peripheral nerves? And they said, no, why would we? I said, well, let me tell you about this little disease called CMT. We gave them $127,000. 6 months later, they had enough data that they got a $350,000 grant from the NIH. 6 months later, on the heels of the data built by the funding from us and the funding from the NIH, they got 100 million in private equity. People thought there's something here. And then 2.5 years later, they were acquired by Novartis for $1 billion for their platform technology, but with CMT1A as the lead indication. So DTX became a $1 billion acquisition. Now, nobody here has to guess what that did to the marketplace. Novartis just proved that CMT is a worthy investment. $1 billion. Novartis just proved that. Thank you, Novartis, for doing that. The other one is Augustine Therapeutics. They had that early data for their HDAC6 inhibitor for the rare types 2F, and I can't remember the other one, but another type 2. And they wanted to expand into 1A, but needed some funding for it. So we gave them $683,000. And on the heels of that data, they were able to raise $85 million. And now they're in phase 1 clinical trials. Those are the safety trials. So we were effectively able to turn $683,000 into a clinical trial. This is the power of seed funding. And this is what we do at the Research Foundation. We look for these opportunities. We look for these companies that are on the precipice, that have great data, but need just a little bit more. And it's kind of projects that nobody else wants to fund. NIH won't fund it. The companies aren't ready for it. Private equity is not ready for it. And we get their data from interesting to exceptional. And we hope to have that investment. Now, I showed you 9 projects and I've got 2 here. So it's not going to happen every single time, but it does happen and we feel like it's really worth the risk. So how do we expand this into all other types of CMT? It's through a campaign that we're calling Velocity. And Velocity, okay, y'all, I just told you $10 million in 3 years. Velocity is $20 million in 3 years because we don't want to stop. We don't want to stop with just the 10. We don't want to stop with just 1A. So we launched a campaign called Velocity, and it's going to be $20 million in the next 3 years. And Eric, you guys want to play that video for me?
I was always the one who tripped and fell.
I started falling.
The interactions at school has been hard.
Very difficult to walk, and my feet started to become misshapen.
More prone to dropping things.
I was always the one that was picked last for the ball game.
Painful procedures. We struggled trying to afford the braces.
My CMT makes it difficult for me to enjoy my life in front of me.
I live fearful of what's in store for me, wondering what part of my body will break down and how quickly.
We have a sense of urgency. We want to move fast, but we want to be precise.
The time is now, the time is right.
We are on the cusp of a bunch of major breakthroughs.
So we want to be able to get these researchers their money to do the work that they need to quickly.
The campaign is called Velocity because we don't have time to waste.
I love the word velocity. You have a focused endpoint and you're in motion already.
We've been, really blessed to have a lot of the progress that's happened in CMT research. And we think that we're at this pivotal point where, treatments are right there on the horizon.
We are competing against the progress that this disease is making in people that we love.
We are mobilizing the globe, the world, to help us solve this problem. The science is progressing today at a pace faster than ever.
There are 4 pillars in our Velocity campaign. The first one is to fast track therapeutics for patients.
One of the things we've developed is a proprietary mechanism whereby we actually rank certain projects, we prioritize projects, we sequence projects with those projects that have the most chance of success.
And that's going to ensure that CMTRF invests our donors' dollars in scientific research that's going to have the best outcomes.
Second, we want to remove the delivery roadblocks.
It's well known that the peripheral nervous system has this challenge of getting drugs delivered to it. And that's going to be a challenge across all CMT subtypes. So that's why it's such an important one for us to really invest a lot of resources into.
Third, we have partners that already achieved milestones. So we want to leverage those partnerships.
So we want to be able to leverage those actual experts and bring them to CMT, but also leverage some of the technologies.
We're going to reach out to other disease industries to find out who's doing the best work with the best practices. And we're going to bring those practices to work at CMTRF.
Finally, growing regenerative revenue will allow us to create a sustainable model so we can continue to do this work.
When there is success, this venture philanthropy model returns money into the foundation that goes back into the hopper and that can, fuel the next generation.
Every project we invest in has the opportunity to grow and regenerate more research.
So if you want to end the suffering, if you want to end the progression, if you want to end the chronic fatigue and the chronic pain, that's possible. And it's possible through the work that Velocity will fund.
They're struggling every single day through their whole life. And if we can do something to help them and resolve that disease, why wouldn't we?
This really is a disease that can be completely eradicated with time and pressure.
I like to say that hope is not a strategy. But if you have a strategy, that gives you hope. This velocity campaign is a strategy.
Give today, be the breakthrough, end CMT.
So I'm coming close to running out of time. I'm sure you guys are glad about that. But what I really want to stress and reinforce is that the science is ready and the research foundation is focused. Focus, focus, focus. What we do is we raise money to fund research. That's our organization. These are 4 areas where we're focused. I can talk about them in great detail and plan to a little bit, but in the interest of time, I won't. I just want to say that we are constantly looking for opportunities, new companies, new people, new players, the people who've been working in the field for a long time who have new ideas, those who have things that are on the precipice of becoming great. And we're constantly assessing programs. You might have, I don't know if you were in here yesterday when we talked about, we have $7 million worth of projects sitting on our desk right now. Oh, I think that was earlier today. $7 million worth of projects sitting on our desk right now. Most of them are worthy of funding. So how do we get them funded? And it's through velocity. And that's just this quarter, by the way. This quarter application cycle, $7 million worth of projects. So the need is there, and we intend to address that need. For anyone who wants to know, we have already raised, what's the number? $7.8 million toward the $20 million. So we're not quite yet a year into it, and we're already 35% of the way there. We have a lot of confidence that we can get there, but it's going to take the big gifts. We've gotten a $5 million gift. We received a $2.5 million gift. Those are awesome. But we also need a lot of little gifts too. So if you think, I could probably give $25 a month, or if you think, I could probably give $2,500 a month, or I could give $25,000 a month, anywhere in between, all the money matters. We didn't intend to make a real ask up here. We just wanted to tell you what we're doing and what it's going to take in order for us to get more treatments, more cures, something on the books for us to feel really hopeful about. And I want you to know that the staff, the board, the scientific advisory board, the research advisory committee, we're committed. We're committed to getting this done. We opened our doors in 2018 to close our doors. We don't want to be around. We don't want to celebrate 40 years or 60 years or 90 years because that means that we're not being successful. There's a problem here and we want to solve it. And the way we solve that is by raising money and funding the best science. I want to thank you all for making the progress and endgame possible. And then I want to thank you for your consideration. That's a QR code if you want to learn all the details about the Velocity campaign, what we've built and where we plan to go, but we can't do it without you. So I hope you'll consider joining us. Thank you.